Hi everyone, it's Lisa Moeller with MedMark and welcome to another edition of DocTalk. Our guest today is endodontist Dr. Eric Herbranson. Dr. Herbranson graduated with an MS in endo from Loma Linda University in 1973 and he has practiced in California ever since. He's been involved in the dental community by serving on many prestigious boards nationally and has been actively involved in education for years, given many lectures on endodontics, as well as presentation skills and microscope techniques. He is a key opinion leader in our endo community and has been a friend of endo practice for many years. Welcome, Dr. Herbranson. So nice to have you today.
Thank you very much.
A little fist bump there,
because
we've known each other for so many years.
Right, and I'm enthusiastic about this.
How are you?
I'm doing fine, thank you.
Good, thank you for being with us.
You're quite welcome.
So, we're talking endo today, obviously.
Endo, yes.
Tell us about how you got into endodontics. How did you choose this field, or did the field choose you?
That's an interesting question because I really liked restorative dentistry when I was in dental school. Did a lot of lab work, but I got involved in a project that involved dental anatomy, and I realized that was important for endodontics. And I was actually rather shy when I was in dental school and felt not very much confidence in my ability to manage patients well. And I thought, well, patients can't control the endo procedure. I can do that. I'll be good there. And I thought it was fascinating work, and so I went into that field. Well, come to find out, I was actually, when I've been doing it a while, pretty good at the patient management thing, and also they can determine the success or failure of these beyond what you think they can. So, but I went into it, and I've loved it ever since. It's been a great career for me.
So, how long have you been in practice? It's been since 73?
I graduated from dental school in 1970.
Uh-huh.
I graduated from my graduate program in 1973.
Right.
And I will let you do the math on that.
It's been a long time.
It's been a while. Yeah.
And you've been a pioneer in endo, and I know that you've worked extensively with SS White.
Correct.
And tell us a little bit about that relationship and how that came about.
Well, that also was an interesting, kind of a serendipitous thing in reality. A friend of mine, David Clark from Tacoma, Washington, had gotten together with another friend of mine. I'd practiced with John Cotomy, and they developed a series of endodontic access burrs that were based on the fissurotomy burr concept. And SS White actually helped them develop these and manufacture them. And between those two guys, I got introduced to Grant Miles, their vice president in charge of product development.
Know him well, great guy.
Yeah, he's a wonderful human being, really. And we were having a casual conversation, and he said, well, we want to do an endo file line. And I said, boy, have I got the file system for you. Because I had been involved with the very, very initial development of this V-taper system. And so we talked, and they actually went down and got the rights for this file system and developed it. And the reason I felt so strongly about this system was because it answered some problems that I viewed we were having in endodontics at the time. And this is an example of a manufacturer responding to the clinical needs with product that needed to be developed, the niche needed to be filled, but that wasn't there, and the big 800-pound gorilla manufacturers weren't willing to do. And it's been a great relationship ever since, and it's a synergism between us as clinicians who are kind of driving these paradigm shifts and a company that's willing to go along with that for us and build the products that we need. So
right.
It's been a good relationship.
They're an amazing company. So endo has changed so much over the years, as you know. And talk to us and our audience about the paradigm shifts that have taken place within the industry.
That's a really interesting kind of involved answer to that question.
Right.
But everybody thinks that traditionally what we do is we clean out the root canal space, sterilize it, and then put a filling in there to obturate it. So we're getting rid of this space which can be toxic to the bone and keeping it that way. And that's still essentially what we do. But how we do that has evolved enormously with technology changes.
Right.
And the there's been three major technology changes with some variations. The first is the introduction of these nickel titanium instruments, which are flexible and will go around curves. Before that, we had stiff stainless steel instruments, hand instruments, and now we have more flexible engine-driven instruments. The introduction of surgical operating microscopes, which happened in the early 1990s, not 1900s. And then the latest innovation has been the introduction of these small field cone beam CT machines, which allow us to do fairly high resolution images of teeth to the place where we can tell what the dental anatomy is.
Right.
And
that's really been a game changer.
That's been an evolutionary change in our ability to see what's going on. And one of my friends describes this as he says, we've gone from a tactile specialty where we're picking around trying to find canals to a visual specialty where we're looking for stuff. And he was referring to the microscope because now we can see at 15, 20 power if we want to.
Right.
But the cone beam CT is kind of Superman vision. It allows us to see inside there without actually going inside the tooth.
Right. It's
and
amazing.
It's a huge advantage. Now, what's happened is that the file systems and the metallurgy has gotten better, and the ability to machine shapes and the flutes of these has gotten better. So we have more sophisticated file designs, and along with that has come a realization that some of the earlier file designs weren't really sophisticated enough in the sense that we were damaging teeth. That's probably the wrong word to use here. We were taking away more dent than we really needed to effectively do the root canal procedure. And so myself and a couple other people got involved in this 10 or 12 years ago when we came to the realization that we could do endo and still conserve the maximum amount of dentin, with the hope being that that maximum amount of dentin conservation would make these teeth more resistant to fractures, so we wouldn't see as many long-term restorative failures. Because endodontic failures tend to occur from root canal procedural failures, and those tend to be short-term. But the very long-term failures in endodontics, the 5, 7, 10, 15-year failures, tend to be structural failures. And we felt that if we could conserve more dentin, we could help that, keep that from happening. In fact, I think that's what's going to happen. And this file system is specifically developed to allow us to do quality endodontics, meet all the requirements of a typical endodontic procedure, and still maintain a maximum amount of dentin.
And you're referring to the V-taper files.
Yeah, this is the V-taper file system that SS White does. Now they're on the second variation of that, and the new variation, the difference is not the file geometry so much, but the metallurgy is a little bit different. These are heat treated, and they're an interesting instrument if you're used to a stiff instrument, because you can actually take the instrument, you know, they come out of the box all straight like this, right? You can take that and curve it like this and bend it. Right, and of course you look at that and you think, well, gee, I broke it. But the fact is, you can stick it in the canal bent, and it'll straighten itself back out once it gets in there. So if you have a very, very difficult access that you can't quite get to, you know, the handpiece is too big and the patient can't open their mouth, you just take the file and curve it, stick it in the canal and use it. And these things go around corners brilliantly. So back in the day, when we were first getting into endodontics, going around any kind of a significant curve was a big deal. And the protocols way back when we were using stainless steel instruments required that we straighten out the canals as much as we could to allow us to straighten out the curve so we could use these instruments. So that straightening process was driven by the instruments we had. Well, that straightening process and the protocols there were what was taking away the dentin that we want to conserve. So what we've done, because we have newer instruments, we've been able to change that legacy idea to where we now don't we can work on a curved canal, and so we can keep all of that dentin. The canal's naturally got more curvature to it, but we can gracefully do our procedures with these newer instruments with the profiles that are designed and the metallurgy that's designed there. So these are a brilliant instrument for that kind of thing, and they exist because we as a group identified the need for these kind of instruments. The manufacturers were able to provide that for us. So.
Right, that's awesome. So Dr. Herbranson, where do you draw the line these days with saving the patient's natural tooth or possibly placing an implant? I think it's a $100 million question in endodontics.
Yeah, I agree with you. That's a very important question. We have a lot of discussion about that right now. And on the one side, you have people that say, well, you know, root canals don't work. Let's just put an implant in there, which simply isn't true. And on the other side, you've got people that are going, I can do a root canal on that and save that. And you can a lot of the time, but sometimes you can't. Mm-hmm. So there's a balancing act between the predictability of these procedures and what's going to work long-term for the patient. And my personal feeling is the people who are best equipped to make those decisions are the people that have expertise in both areas. And there are a few guys out there now who are very high-quality endodontists with microscopes and cone beams and those kinds of adjuncts who are also quite good at implants. And so they know what they can do clinically endodontically, but they also know what they can do clinically from an implant standpoint.
Right. And
they can do that balancing act between what's most appropriate in that particular case. For the last few years, there's been this kind of anti-endodontic thing, and that pendulum is starting to swing back. People are realizing that implants are not the panacea that everybody would like to think they are.
Right.
They have maintenance issues long term, and they have failure rates long term. So now we're having more robust, centered discussions about those two things. So It's a case by case thing in reality, of course.
Yeah, I can imagine. But who wouldn't want to save their natural teeth? And when you do that, that's always going to be your first choice.
If it's appropriate to do that, you need to do that, and you have to look at cost-benefit ratios and those kinds of things. But I mean, I get teeth in my practice. I recommend extractions and implants on, but I see teeth that can be gracefully saved with endodontics, and the referring dentist doesn't understand that because they don't understand what we can do when we really put our mind to it.
Right. So share with our audience, since you've been in practice and you've been in endodontics for many, many years now in your career, share with our audience what some of your best practices are in your career and how they can push their practices forward using some of these.
Well, that's an interesting question. Best practices. You have to go into what you do with a commitment to doing it for the right reasons. You need to go into it trying to help people fundamentally. And that requires that you end up with good clinical skills, so you have to develop your clinical skills. You need to take courses. One of the reasons I teach is the fastest, best way to learn something is to teach it. So that teaching drives me in that direction. There's an intellectual curiosity that I get answered with that. But to actually physically do the work, you have to surround yourself with people that are also committed. And that means you have to put a staff organization together. So you got to have staff around you that likes it. You've got to have doing it for the right reasons. Eventually you want to get paid for it a little bit.
Yeah, that'd be nice.
And then you have to have family support, and then you have to have balance in your life as far as what do you do extracurricularly to kind of balance that.
Right.
So,
I think that goes for any industry that you're in, really.
And one of the things that I do, one of the reasons I teach, is that I have a lot of extracurricular interests, like photography, for instance, and I get to use all of those things in my presentations, so I get some of that, that creativity out actually inside my career in dentistry, which is one of the reasons I've broadened that career to include educational.
How often are you teaching these days?
It's all over the map, but I go internationally a couple of times a year and probably 10, 15 major lectures every year. And then things like these conversations.
Yeah, the fun stuff.
Fun stuff, right?
I hear you are quite the fly fisherman.
Well, when I was younger, I had good knees. I was both a good skier and a good fly fisherman. But I don't do that quite as much, but it's a phenomenal sport because it's really, really hard to be angry when you're fishing. And the water flowing by relaxes
So
you.
peaceful.
It's a very meditative kind of a sport, and that's one of the reasons I really like it.
It looks very complicated.
Well, it's interesting that you say that because dentists make particularly good fly fishermen because they're generally fairly smart guys and they're detail oriented and they've got good hand skills so they can tie those little tiny knots. And
right.
So
it comes in handy.
You could be out on the stream and half the guys out there are probably dentists because they've got the skill sets to do it. There is a learning curve to it for sure.
I'm sure.
And it's fun.
I'm sure. Yeah, it looks like it. Is there anything else in closing, you'd want to speak to our endodontic community about?
The one thing I'd like to add to this discussion is we talked about SS White and how these instruments have kind of changed the way we've done things, and that was driven by our need to try and make the teeth stronger by conserving dent, and that really is the main focus of these instruments.
Right.
But what's happened here, that combined with these newer technologies like the cone beams, the microscopes, is kind of given a bunch of people in the field permission to question a lot of different areas. And so what I'm seeing now is guys questioning the way we're doing other things that have traditionally been there as legacy procedures and legacy concepts. And I see this subtle change in how we're starting to view things. And even the dental conservation change has gone past where I thought it was going to go. And it's being driven by these young guys who are really curious. And I think we are actually on the beginning of potentially a paradigm shift in how endodontics is being done. It's certainly being approached differently than it was 20 years ago. And it's kind of exciting. I wish I had another career ahead of me.
Well, you do, writing for Endodontic Practice Magazine.
There we go, right. Well, anytime, I enjoy working with you.
Keep those articles coming. It's important for us to, keep spreading the word and getting the message out and educating these doctors. So.
Well, you're doing a good service with these publications, and I thank you for that.
Thank you.
For my colleagues, I thank you for that.
Thank you. We appreciate that. We try to do a good job and service the industry, so we appreciate that. Thank you so much for spending time with us today.
Welcome.
It's always a pleasure. Double fist pump for the end. Good job.
All right.
It was great speaking with you.
Thank you.
Come back soon.
I will.
Okay. That's going to do it for this edition of DocTalk. A very special thanks to Dr. Herbranson for visiting with us today. We'd also like to thank our sponsor, SS White. They've always been a big supporter of endo practice, and we appreciate them and their contribution to our endo community. For more info on their great products, go to sswhitedental.com. And as always, for more information on everything endo, including earning CE credits just for reading our magazine, please go to endopracticeus.com. Thanks for watching, everyone. We look forward to seeing you again soon. Take care.